Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Jenni Johnson, the founder of Jenni Johnson Breast, Bottle, and Beyond. Jenni is a registered nurse, an international board-certified lactation consultant, and a craniosacral body worker with a passion for helping families navigate breastfeeding, bottle feeding, pumping, weaning, and everything in between. Jenni is especially passionate about addressing birth trauma and body tension, tongue and lip ties, helping women get the most out of pumping, and ensuring that families truly receive the support they need to meet their feeding goals. She is such a blessing to families in Northeast Wisconsin as she offers in-office support in Green Bay, Appleton, and Antigo, as well as mobile support where she'll come to your home. Outside of her work, Jenni loves to travel, read, and sing, plus she's been married to her high school sweetheart for nearly 35 years. We can't wait for you to learn from her, so let's get started with today's conversation.
Hey guys, welcome back to the podcast. We're super excited to have Jenni back here with us. We're excited to learn more about breastfeeding and all the things. If you guys haven't listened to the first episode, we went through Jenni's story. We also talked a lot about the basics of breastfeeding, and it was a really good episode. And in this one, we're going to talk more deeply about different issues you might have with breastfeeding and like pain and that sort of thing. So let's start off with that ultimate question. So what are some common signs that something is off?
So breastfeeding should not be painful. And I know that's hard for people to hear because it was for many of us. It should feel just like a gentle tug. Babies should be latched deeply onto the breast tissue, not just the nipple. Kind of always chuckle that, it's not nipple feeding, it's breastfeeding. And having that good deep latch gets the nipple resting into the soft palate. They're not compressing and pushing it up against the palate. It may be normal to have some discomfort as you start, especially if your nipples have been tender and kind of achy, your breasts get achy with your periods. It's a very similar hormone exchange. So sometimes moms will notice that, if my nipples are tender when I get my periods, and now they're kind of tender after I've given birth, and then somebody's kind of chewing on them, right?
Yeah.
So like, what's normal, what's not? So it can be in the normal range to have some discomfort, but it should never be painful. It should never be toe curling, and there should never be bruising, bleeding, or like hamburger-like looking nipples.
Okay. I mean, that's like key. I wish somebody had told me that initially. And this is why it's so important to be talking to somebody like you, even in pregnancy, because you understand this stuff ahead of time. And the first sign, you're like, I'm back to Jenni.
Exactly. Right? Yeah. And you've already worked with someone, them, you're comfortable calling and being like, hey, we talked about this and this is what I'm seeing. I feel like it gives you terms and words to use when you don't know how to explain what you're going through either.
And then like how much discomfort is normal, right? I think that's really important too, because I feel like I would be like, well, how much pain am I? Should I be in? Well, you shouldn't be in any pain. Well, I'm uncomfortable.
Exactly.
It's almost like, if you're working on something new, right, with your hands, you almost have to have calloused, right? I feel like that might be a good way of thinking of it too.
So we should never have to prepare our nipples for feeding. Back when I had our son, so he's 32 2, so it's been a few years. They actually suggested taking a dry washcloth and rubbing your nipples every day to help toughen them up and get them ready.
Oh my goodness.
Yeah. And when I worked at the hospital, there was a grandmother that told me they used to give her a little bottle of alcohol, the one where you push the top and the alcohol comes up, in cotton swabs. And she was to cotton swab alcohol on each of her nipples to sanitize them before she fed. And she said, I cracked and I bled and I stopped it when I went home and things were fine.
I was just going to say,
that.
wouldn't that just dry them out?
Oh, and pain. Oh my
Yes,
gosh.
Yes. And any, think of a paper cut and hand sanitizer.
Absolutely.
So we've learned a lot over the years that, we don't have to do those things to get prepared. I feel like preparing yourself to understand latching, how to get baby on that breast well, makes the big difference.
I feel like cracking, I don't know, bruising to me would be like, oh, there's definitely an issue with the feeding here, but cracking and dryness and things like that seem really common. Is that something that you really shouldn't be experiencing at all, or what causes that?
It isn't something we should be experiencing. If you think about the nipple tissue being a lot like your lip tissue, it's a little bit thin, it's easily chapped, so we want to take care of it. So preparing yourself in that respect can be helpful. Our milk itself is a great emollient. After a feed, you can squeeze a little milk out, rub that on the nipple, let it air dry before covering, because just like with our lips, the more moist they are, the more chapped they get.
Are there other things that you can do to help soothe any kind of discomfort or pain or current cracking you might have?
So my favorite is coconut oil. And most people have it in their cabinet. I'm a minimalist. I am cheap and lazy. I don't like to spend money. So if you have organic coconut oil in your cabinet, just dab a little bit of that on, and it can help heal those nipples a little too.
And I know a lot of people also experience signs from the baby that things could be maybe not going perfectly. Are like frequent spit ups or like clicking sounds or other things that people might be noticing from the baby, what's normal and what's not?
So feeding should be pretty soundless. We shouldn't have a lot of that clicking and smacking noises. If we've never watched someone else nurse their baby, we don't really know how to do it other than what we've seen on TV. And just like when you drive a car on TV, you move your arms a lot. You move that steering wheel around. Generally, when a baby is feeding on TV, we hear a lot of, and that is not normal for breast or bottle. So sometimes parents will be like, well, I breastfeeding was uncomfortable, so we gave the bottle, and now the baby is spitting up more with the bottle. The intake of air is what causes that bubble. That bubble then pushes the milk out, and we get that kind of spit up and refluxy kind of things going on.
And even gassiness, always having to do those bicycles and stuff,
Yes.
is that can be from them swallowing air.
Absolutely.
So that would be a good indication to see someone like you.
Yes. And it could be position. Sometimes we just make these slightest little adjustments to get baby in, so chin is in and they're latched deeply onto that breast tissue. And sometimes it's changing sides. Sometimes babies will latch better to one side than the other. And I know we're going to talk a little bit about birth trauma and how that impacts feeding. And it really does. When you think of pregnancy and confinement and how tight baby is in there, and then delivery really being like a car accident, sometimes they're just sore and uncomfortable, and we need to find a position where they can relax and latch well.
So what are your favorite breastfeeding positions? Is it, because there's also all the tools essentially of like a boppy and all these other things. If you're trying what you just said about, it's a car accident for the baby, like that's important to think about. What is the most optimal breastfeeding positions that you recommend people starting out with?
So biologically, babies should really go chest to chest with mom right after delivery. It helps them work through their reflexive feeding reflexes. It helps them work on finding, attaching, and familiarizing themselves with that breast and how to feed. They've sucked on hands in utero, but it's a big change to then go to breast. So skin to skin is really my favorite space. And you can go back to skin forever. We can always use that if we're having a nursing strike at 8 months. We can snuggle up skin to skin again and kind of reintegrate some of those reflexes. Being laid back so that you're not completely flat, like slightly elevated, gives baby gravity to help them as well. They actually get held up against the chest versus sliding. I feel like when babies are confident and comfortable, they can relax and then work on feeding. Sometimes it's a straight head up and down, heads at your chest, their belly button's close to your belly button. Other times, maybe we slide a head to the side a little so baby's at a slight angle. I'm not a huge fan of pillows. I feel like nature gives you a boppy. Your belly remains at that kind of 5-6 month space for a little bit because that's where baby should kind of sit to be in a good position. We practice positioning in our pregnancy visit with dolls because I want parents to understand how slight shifts in body position can change how baby is making their way to the body and latching deeply.
And you had mentioned the trauma piece. You talked briefly about baby, but can a traumatic birth also impact the woman's side of a breastfeeding experience?
Absolutely. So one, in general, the trauma may create a slight aversion to the baby. It may not be a direct correlation, but we have a little animosity to this child. You caused me some pain. This was uncomfortable. Not everybody bonds directly with their baby right away, and they feel like something's wrong with them, and it's like, no, natural. Like we've all been in that space where you've wanted something really badly, and you get it, and you're like, is this what I really wanted?
This is what I ordered.
Yes, exactly.
I'm actually glad that you said that because it's bringing me back, right, to the times when my kids were born. But I remember having a discussion with a friend who had said, did you have love at first sight with your baby? Because I didn't, and I'm wondering if there's something wrong with me. And so just even you saying that, like, there can be some feelings and it can be normal and it's okay.
Absolutely.
So, continue on with how the birth experience can impact a woman.
And many times, too, a long labor can really exhaust you. I find in my practice, if mothers have pushed for just like 5 minutes, 10 minutes, we have this really fast delivery, they're almost in shock. You kind of have this, like, that happens so quick, like, I can't even believe that I have this child. Mm-hmm. And then those other moms that have pushed for 2 to 4 hours, they're exhausted, they're sore, they just want to kind of get some rest. I feel like those are the spaces when the partner has been involved, that they know how to kind of help get baby skin to skin. They can kind of help with attachment and take some of that off of mom. Like, she can just kind of settle in and recuperate herself as well. And then to those partners understand the signs of, is the baby satisfied? Is the baby not satisfied? The initial feeding is related more to mother than it is to baby. I feel like watching your baby latch and being comfortable builds your confidence. And when you're confident, you're going to do better. And a baby suckling at breast stimulates oxytocin that helps contract the uterus and helps prevent hemorrhage. So it's really important that mom is allowed to kind of move through those steps. And we need to remind her that it's partially for her well-being as well as baby's well-being. And we'll get Latch figured out. It doesn't have to be picture perfect from the get-go.
Mm-hmm. And you even mentioned something there that I feel like a lot of women who are first-time moms do not expect, is that when baby is breastfeeding, you actually do have pain from your uterus contracting, and you're like,
yeah,
I'm just a hot mess right now. But like they don't expect that. So I appreciate that you brought that up as well. And I do want to shift gears just a little bit here to more of the physical changes that maybe happen to baby from birth. Does the type of delivery affect a baby's head and mouth structure? Because you think about if it comes through the vaginal canal, the head is kind of getting compressed. And then is that a good or bad thing? I know that they're malleable, but I know you also specialize in craniosacral work. And so this is where I'm kind of like, what physically happens to the baby? And do things kind of need to be almost checked to make sure that their jaw and their skull are in alignment for ideal feeding?
Absolutely. There's so many factors. In the quick deliveries and the long deliveries, we see that sometimes those cranial plates don't go back into space as well. Sometimes we get little overriding sutures, and it's generally the occiput, the plate at the back of baby's head. It's actually in 5 pieces as a newborn, and that can slide under the parietals. Sorry, you guys don't have a video because I'm talking with my hands over here. And we also see that the frontal bone will slide up under the parietals. So your parietals kind of cover the sides of your head from the center of your head down towards your ears. And then there's a little bone right about where our ears are that's called our temporal bone. The parietals sit funny on top of the temporal bone. It can actually affect where the jaw is sitting in.
So the bones can actually kind of get stuck a little bit underneath. That's interesting.
Would that, as the baby grows, if you did nothing, would they as the baby's skull grows, would they kind of go into place, but then it could lead to feeding issues up front? Or is that something that could really lead to long-term challenges?
Yes, yes, and yes.
Oh my. Okay, tell us more.
So if the plates don't slide back into space, I've had some babies where we have a canted jaw. The jaw fits in on one side but not the other. Makes it very hard for a baby to close their mouth. Makes it very difficult to get a good seal. They can seal with one corner of their lips, but they can't seal with the other corner. So we get leaking out of one side. They're able to feed better when that side is down and covered by the breast tissue, but when it's up on the top, it's hard to close and suckle. It can impact the tissue in the mouth. So we all have frenulum. We all have actually 7 points that we can have frenulum in our mouth that can cause kind of restriction of movement. And sometimes it's not related to the tissue itself. It's related to the muscles and the bones around them. If they're out of alignment, it can pull. So then that too can kind of cause movement issues. I feel like if we think of it like you're chewing gum with a headache, right? Babies have had a traumatic birth. Even a cesarean delivery, if they go in and pull baby, we've caused strain and stress on their head and their neck. So if we expect them just to like, boop, pop on, eat like nothing's happened, it can be a little discomforting for them too. I've had a few babies where they suckle a few times and cry. And then they suckle again and then they cry. So then we take a good check head to toe. Are things lined up? Is there a space that we can help them kind of relax some of that tension and then move through to feed better?
So I'm hearing that it would really be beneficial for every baby to be evaluated in this way, just to make sure that their skull is in proper alignment, probably check for oral ties, like you had said, tongue and lip ties, things like that. To me, I'm like, oh my gosh, if I could go back and know the things I know now.
Chiropractor, craniosacral therapy.
Yes.
This should just be standard practice.
It
this
really
should just be a baby is born. Let's do an evaluation, make sure that they're in alignment because they just went through the car accident.
When I worked at the hospital, I worked with a beautiful group of family medicine DOs that did osteopathic manipulation. And it was wonderful to watch them work with their babies because they assessed them from head to toe like that.
Oh, that's great.
And it was beautiful. If a chiropractor is in your family practice already, they're a great resource to check in with and see how baby is doing alignment-wise. Because even confinement, if baby's head is turned and we've got neck tightness on one side, it's going to impact how they can relax, be comfortable, and feed, breast or bottle. And if you're in the space where your pediatrician doesn't really believe in chiropractic care, I always suggest a pediatric physical therapy assessment then, because I really feel like every baby deserves a quick little head to toe check to see that they've navigated that birth process well.
Wow. This is like mind blowing. It's just like how we've talked about in the past about every woman should see a pelvic floor physical therapist. Well, every baby should be seeing somebody specialized like you that can make sure that they are in alignment after this process. There are a couple other topics that I want to make sure we touch on before we close this episode. When kiddos are getting a little bit on the older side, how do you navigate biting?
Biting is always interesting. I think it's funny that as soon as a baby starts drooling, we think they're teething. It's not it.
Yeah, or if they're extra whiny or anything.
Yes.
Yeah,
so
teething.
basically, when babies bring hands back to mouth at about 3-4 months, their bodies are just trying to get rid of the germs. So the drool is just expelling germs. It's nothing about the teeth coming in. Their body's just keeping their mouth clean. But those teeth do start to appear, and they can be like little razor blades. Many times, if mom has felt that feeding was okay, not great, up until that point, all of a sudden they feel teeth. What's happening is the tongue doesn't cover the teeth, and they'll feel the scraping as those teeth start to come in. The tongue should really extend past the gum and lower lip and cup around that tissue. But when a baby starts to realize that they can nibble, there's a lot of interesting ideas on what to do. My favorite is to push their face into the breast. We cover their nose, they can't breathe, they let go. And then you put it away. Because they learn really quick, if I do that, I don't get milk.
Yeah. Yeah.
And some moms have had some success with that. Other moms can anticipate that baby's going to start chewing. It generally happens late in the feeding.
When they're kind of like, they're just playing.
Yeah,
done.
They're like the one chip out of the bag at that point, right? They're just finishing up. I tell moms, if you anticipate it, break the latch and put it away. And they start to learn that, if I'm going to chew, if I'm going to hurt mom, I'm going to not get my milk. So they learn to be helpful. Another theory is to yell.
I think I did that.
Well, and sometimes we do it involuntarily.
I think I did that.
Yeah. You're like,
yeah.
But again, that startles them. They let go. And many times they're like, I don't want to hurt mom.
Right.
So they cry, you cry, and then everything seems to go a little bit better.
You're telling me my story right there.
Well, I appreciate having a few different things to try because every kiddo is going to be different,
Absolutely.
right? And,
yeah.
And as they get older, especially if you want to breastfeed longer into the 1, 2, 3 years, I mean, they have a mind of their own. So
and then they're going to have molars. So we're not even talking just little teeth anymore.
Another challenge a lot of women struggle with is mastitis.
Yes.
So let's just spend a couple minutes talking about that as well. What is mastitis? And what are the signs and symptoms? And then what are your options to take care of it?
So for years, we were talking about clogged ducts or plugged ducts. And recently we've realized that it's not even what's happening. When the breast becomes overfull, that a villi, where the milk is produced, will stretch and there creates gaps between the milk producing cells. The milk then leaks into the tissue around, and that's what causes that immune response. So the best way to prevent mastitis is to not get to a space of being overly full, keeping your breast in a comfortable space. So we're draining early on, about every 3 hours at the max. We'll then move into a 4-hour stretch, 5-hour stretch. And as time goes on, we may have that space of being overfull once in a while, but it's not chronic. Once there is milk in that tissue, the tissue is going to be irritated. So we used to tell people to take a hot shower, really push and massage. Well, now we know that we're probably pushing more milk into the tissue than getting the milk out. So now we're talking about using ice packs, using cold a couple times a day for about 20 minutes, help take the swelling down a little bit, and removing milk gently but efficiently.
Okay.
Interesting. Yeah.
Can a woman take care of mastitis on her own? Because typically they're put on antibiotics, aren't they?
So if we can catch it before we get to that inflammation immune response, we can take care of it on our own, draining the breast fully, helping get that tissue kind of settled in. Taking an anti-inflammatory helps take the swelling down. So we can avoid doing antibiotics. Probiotics is one great way. You build your system so that the system is ready to take care of an issue if it arises. So we can kind of help be on that preventative end versus the reactive end of the antibiotics.
Okay. And if one of your clients or somebody who learned about you has mastitis, is really, it can progress quickly and it can be really painful. So then it's kind of feels like an emergency situation. Is that something where they could call you and you could help them through that? Or is that really, would you be referring them to call your OBGYN, or how does that work?
So an established client is always welcome to reach out and discuss an issue with me. It really is unethical for me to share information with someone that I don't know their history, and I don't know them. So generally, if it is someone that is new to my practice, I do suggest them reaching out. I will send them resources on the new mastitis protocol, kind of the questions to ask their providers. But I really need to see them as a client to give them good, sound information.
Sure. That makes sense. And then, of course, I have questions about like how can you utilize pumping to help work yourself through this? But we're going to save that for the next episode because that episode is all about pumping. But before we finish out this one, I do want to hear just a little bit more about your body work that you offer. So in our first episode, we talked about your free breastfeeding basics class, also your free supportive Saturdays that women anywhere from pregnancy through anywhere in their feeding journey, they can attend that. But tell us a little bit about your body work because you do it not only for kids, but also for adults. So is this really just that craniosacral work that we talked about, like when we were talking about the trauma side, or is there more to it? Tell us about what you offer.
So when I first learned that I did craniosacral work, one of those wonderful DOs that I talked about earlier saw me holding a baby and said, I didn't know you did craniosacral work. And I said, cranio who?
Oh.
I had no idea what they were talking about. Then, like as the fates push you to where you need to be, when I went to the next lactation conference, there was a flyer about craniosacral workshop and how to learn more. So I've been to Norway, Michigan 5 times to train with Regina Callahan and the Still Mountain Institute. She was working for another place when she started teaching there and has now opened her own institute. And actually this spring, I'm going to certify as a craniosacral provider with her. So when we did the training, we worked on adults. And I really became passionate about helping people through their tension and trauma with the craniosacral work. So it's a light touch energy work, just the laying of hands. I provide your body space and energy to do the work that it wants to do. Sometimes it looks like a ballet. As arms and legs unwind, they're kind of all over the place. Sometimes it's just very quiet, subtle work. It really depends on the person. I've helped unearth some traumas for people, so we provide the safe, comfortable space to work through some of that as well. I'm seeing an adult client right now that had some trauma to her right side from a car accident, and she has never had relief of pain for 10 years. And her husband and my husband work together, so she kind of heard about me through the grapevine per se, and we've gotten some relief. Now, we haven't gotten rid of her pain, but we've gotten her some relief, and working in conjunction alternately with her chiropractor have gotten her to a place of comfort.
Fabulous.
So this can help with the mental side, like you said, with trauma, releasing traumas. This can help with the physical side. Very interesting. I feel like we should have a whole episode about this with you now, but we're out of time for today. But we do have 2 more episodes coming up. Like I said, our next one's going to be about pumping. Our last episode together, I'm really excited about because it's about really specific situations that's really going to be helpful for people going through those, like induced lactation, relactation, and post-surgery breastfeeding. What is possible? So Jenni's going to fill us in with all of those as well. We have 2 more episodes of your knowledge that we can't wait to pull from your brain, and we'll be back soon with the next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.